Professor Rita Redberg, editor-in-chief of JAMA Internal Medicine, this year is the special guest of the annual Congress of the Italian Society of Internal Medicine in Rome. In a few minutes, she will receive the SIMI International Award 2022. Professor Redberg, which are the trending topics in JAMA Internal Medicine at the moment?
Well, of course, we're post-pandemic or still in the pandemic era. I don't know when it's ending, and so we're, like most medical journals, talking about COVID. But then related to the pandemic, we're seeing a lot more articles about telemedicine, and should we continue some of the changes we made to take care of patients during the pandemic, as you did here in Italy, and converting to virtual or talking by Zoom. This is very nice to have this meeting in person, but some patients and some doctors have found it convenient to have telehealth, and so we're getting a lot of articles looking at, is telehealth better, is hybrid better, what are the differences and that. We also get a lot related to that in digital health and how we're now going to see more digital things in medicine and more personalized medicine, personalized like gene therapies and gene responses and gene risk scores, and it's all very new and people are interested in looking at that. And then related also artificial intelligence, and are machines going to replace doctors in some roles like reading images or reading scans. So those are some of the new things we see besides our bread and butter topics of how to take care of patients better with heart disease, kidney disease, lung disease, all kinds of things.
Good. So you said COVID-19 is still a big issue, but which are other emerging issues in global health?
Well, I think climate change is the other big thing we think about so much. We don't traditionally think about the climate but clearly in terms of our health, climate change is very large. And so we are starting to think about and look at what is the role of medicine in contributing to the problem, and how can we help. So we're in fact getting articles on not just on should we still be traveling for conferences as much as we do, but also on looking at medical imaging and other, which I'm not sure that's a big part, but then the bigger pictures of, how is climate change impacting our health, of course, because of the heat, the drought, the fires. It's just been a very terrible impact and a very big public health and global health problem.
An excess of a good thing can do harm. That's why some 12, 13 years ago, you launched the movement Less is More. Can you tell us something about this idea, and where are we now?
Sure. So along with some of my co-editors like Deborah Grady, we did launch Less is More with the idea that healthcare is good, but only at the right time for the right person and at the right moment. And sometimes if there is healthcare that is not fitting those characteristics, so there is no benefit, and there is unfortunately healthcare that we have and has no benefit, there are still risks. And what we thought is that people don't really think that there could be a risk. They always tend to think, well, if I get another test, I'll have more information and it can't hurt. And so we launched Less is More with the idea of educating doctors as well as patients that tests can hurt, treatments can hurt, and most importantly, if it has no benefit, you just don't need to do it. And so that's why we say sometimes less is more.
Heart disease is the leading killer of women. Professor Redberg, what is still missing in this field of gender medicine in order to make the world a better place for women?
So first, I think it helps a lot to have more women in the profession, more women doctors, and it's wonderful just seeing this conference and being at the University of Milan for the last few weeks, because there are so many women medical students, trainees, and on the faculty. And certainly even in my own field, cardiology, which had very few women when I started, I now see more women. But we also need more women in clinical trials. So when we study new treatments and new procedures, very frequently, for all kinds of reasons, which are not good reasons, the trials are done mostly in men, and women are different. And so we need to have more women. And what I have been trying to do in the United States is convince the Food and Drug Administration, like the European Medicines Agency, that they should not approve new treatments unless women were studied as well as men. And I think it's really important that we do that so that we can then be sure that what we're doing is right for women as well as right for men.